Welcome back. My next guest is Dr. Susan Goslett. She is a chiropractor with a special interest in pediatric and family wellness. She's passionate about helping parents navigating their children's health, particularly in the modern world where screen time and posture play a crucial role in development. With extensive experience in neurological chiropractic care, she works with families to optimize spinal and nervous system health from pregnancy through childhood. Dr. Susan also regularly educates parents through talks, workshops, and blog articles, making complex health topics accessible and practical. Very good morning to you. Welcome to the program. And I have to start off by asking you this question. For years and years and years, and I think I still am confused about when do you consult a chiropractor or a physiotherapist? How do I know that my nagging backache has got to do with would come right if I visited a chiropractor rather than a physiotherapist?
Good morning, Julie. This is a very common question that many people wrestle with. I think if you have a spine and a nervous system, you need to see a chiropractor. So pretty much everybody could benefit from chiropractic care. When is it more appropriate to go and see the physio versus the chiropractor? Is usually that physiotherapy works with rehabilitation type processes. So you've either had an injury or surgery, and the physiotherapist is then going to help your body repair and heal from those insults that have happened to it. Behind that is the nervous system, which controls absolutely everything that's going on in your body. So to be healthy and well, you need to have a healthy and good functioning nervous system. So that takes the injury or the surgery as being a stress on the nervous system, which then can impact how that message travels from the brain to the body and the feedback from the body back to the brain. And chiropractic care is aimed at correcting that cycle so that you can heal better as well as feel better.
Okay, I recently had an accident. When I said recently, it was sometime in November. I fractured my wrist and I fractured my my ankle. So obviously it was difficult. I was in a cast and, all of that, the whole drama around that. I'm almost back to normal. And I'm now at the point where I'm functioning, I should imagine, at possibly 80% regarding those two limbs. What do I do? Do I now go to my chiropractor? Does he have to realign my body? Because from time to time, I still have discomfort in the ankle, obviously, because I drive a manual car. And then I suppose I'm trying to get the hand as mobile as possible. So I try and work it to its fullest ability. Am I on the right track?
Absolutely. So I'm sorry to hear that you had an accident. That's and the body goes through these things as an injury, as an insult. What we also have to remember is that every tissue of the body has a particular healing time. So we know that bones actually heal really quickly. A fracture will take 6 to 8 weeks, and it's got a beautiful callus formation, and it's well. But in the process of being in a cast and immobilizing that so that the bone can heal well, means that the soft tissues around it, the muscles, the ligaments, the tendons, have been immobile for a long period of time. And those need to be rehabilitated. The movements that you do in day-to-day life are certainly going to be the things that promote that process. It does, however, need support and rehabilitation. We often underestimate the long-term effects of these kinds of injuries. I mean, you're up on your feet, you're 80% right. So that's good enough, isn't it? And sometimes it's okay, but as we get older, our bodies are also not as quick to heal and often need support. So in this process, yes, realignment is one of the things that's most important. And I will pump the chiropractic, of course, because I'm just a little biased that that's the best course of action. If you can get the nervous system to reset from that injury, because that injury is like a big shock to the nervous system. And if you've had a shock, you know how your heart starts beating a whole lot faster and your breathing changes. And we don't always come out of that stress response as well as we should do. So the adjustment helps us cope better and adapt better to the stresses, which means that the body is then in a state where it can be in a healing state rather than in a defensive state. The tissues themselves may then need attention, and some chiropractors do quite a lot of soft tissue work. Others prefer to refer to the physiotherapists who are specialists in that area, and they can do the direct therapies that are needed around that wrist and around that ankle. You may even consider seeing a biokineticist who can retrain the muscles and the joints so that they're functioning through a full range of movement. Sometimes an occupational therapist, depending on what the influence is in your life, so that you can restore those joints to full functioning.
Okay. I need to say something to you. This is just, it's amazing how the universe puts or brings people together. About 2 weeks ago, in the area that I live in Johannesburg, someone asked about referral to a chiropractor. I don't know what her issue was, but she wanted to know if there was a good chiropractor in the area. And lo and behold, your name came up. And the person who responded said that you're brilliant with babies, infants, and adolescents. Your name kind of stuck in my mind, but I kind of moved on. And then last week, I was going through social media, and there your name popped up again with obviously those diagrams of how you assist children when they're spending too much time on the screens, how they stoop. And I thought, gosh, I need to talk to this woman. And here we are.
Here we are. Wonderful.
Here we are. What also jumped out at me regarding you and the work you do, Dr. Goslett, is you are in fact a brain-based chiropractor. Goodness me, what on earth is that? Because I have engaged with a chiropractor in the past, and I must tell you that on the first few occasions when I went to him, he was just pulling me and prodding me in all directions, and I thought, I don't like this. I don't like this. But I must tell you, after all the pulling and prodding was done, I felt so much better. Yes. So brain-based, what is that all about? And tell us also about all this pulling and prodding and, pushing us.
What's going on? Yeah. What are chiropractors doing to you when they do that?
Absolutely.
So the first thing perhaps to consider is, what is it that controls everything in your body?
The brain.
Exactly.
The
the nervous system. So your brain is talking to your body through the nervous system. And it's very, very beautifully protected by the skull and your spinal column. So this bony structure, your spine, is doing a very important job of protecting your nervous system. Those nerves are communicating from your brain to your body and all the messages that every single part of your body needs. So how fast should your heart be beating? How much insulin should your pancreas be secreting? How much bile should be coming from your liver and your gallbladder? You never have to think about these things. Your body is doing them automatically, as long as the message is getting from your brain to your body, and the message from your body to give feedback is getting back to your brain. And all of this is happening through the spinal column. So chiropractors specialize in working very specifically with the joints that make up the spinal column, because that is our access point into allowing the nervous system to signal the way that it should do. Can I give you an analogy?
Please.
So if you are watering your garden, and we know that gardens need care and maintenance, and they're not going to be beautiful if we don't pay them enough attention. And if you're watering your garden, but there's always a sneaky somebody around who comes along and steps on the hose, what's going to happen to the flow of water coming out of the end of your hose?
Interrupted.
Exactly. So you perhaps don't see the person stepping on the hose. So you go to the tap and you turn up the tap so that the water is coming out at the pace that you need to water your garden. And you turn up the tap and you turn up the tap and you turn up the tap, but there's still only a trickle coming out because somebody's stepping on the hose. So that interference in the flow from the tap to the outcome is now interrupted. And we need to move the person off the hose. So when your spine is not functioning the way that it should do, it's interrupting the flow, particularly of the fluid, that cerebrospinal fluid that surrounds the brain and the spinal cord, but even impacting into the nervous system itself and interrupting how the signal travels. So chiropractic removes that interference and allows the signal then to flow the way that it should do. You do have to remember, however, that you've just turned the tap up a lot. And that needs to be turned down. And it takes a little bit of time for your nervous system to reset the tap to the ideal flow so that you can water your garden the way you should do.
Wow, so very clever. Okay, so what would be the difference? You are a brain-based chiropractor. How do you differ from a traditional chiropractor?
So there are many tools in the chiropractic toolbox. Everything from very manual adjustments, which will often make what we call a cavitation sound, a popping or cracking sound when they're applied to the joints. Most people have come across somebody that cracks their knuckles, and it sounds very much the same. And all that is a release of gas within the joint, which allows it to move. That movement sends a signal up to the brain to say reset. There are other tools in the toolbox, though, using not only such very manual techniques, but more gentle techniques, which often use tools like an integrator or an activator, or other more touch-based techniques that are then resetting the nervous system. So if you're looking for a more gentle technique, you may need to ask your chiropractor, what techniques do you practice? And are there more gentle techniques that you could recommend or that you can do? Because many chiropractors do a few techniques, but we all develop our favorites and we practice those the most frequently and become the most skilled at those techniques. So to find a practitioner that does what they do a lot of the time is going to give you somebody that has a great skill set and can help you.
Okay, I a while ago came across I don't know if it's an old housewife's tale or what, but I've been told that babies who are colicky needs to be seen by a chiropractor because they manipulate the spine, and the baby will overcome the colic almost immediately. Is that a fact or a myth?
It sits on the spectrum. So yes, chiropractic has been shown to be very effective in adjusting babies with colic. You do need to see a practitioner who has done a little bit of extra training in working with pediatrics. Children are not small adults. They have their own developmental processes that they're going through, and it is important to know what is appropriate at a particular age. Small children cannot tolerate the manual adjustments that we would give to an adult. Their bones are not yet formed in the right way, and that development is going to happen as the child grows and as they're loading their system. So pediatric chiropractic is a lot more gentle. We use as much pressure as you would put on your eyeball. If you press on your eyeball, that's how hard you can press. That is as hard as the pressure that we will apply to a baby when we're adjusting them. So the assessments need to be a little differently because we are looking at a child that can't tell you this hurts here and that's not working well. Whereas with adults, I can ask them, when did this start? How long have you had it? Where does it hurt you? How bad is it? With babies, we need to be a lot more observational with how they're doing. And the process that they've been through pregnancy, what was mom going through the pregnancy? What were her stress levels? What were her movement levels? What was her diet like? The birthing process itself, as well as then what happens with the baby after they're born, can all put stress into the system, which can lead then to colicky symptoms arising, and helping the baby deal with that stress and improving movement and in their bodies. So perhaps during the pregnancy, they got into a funny position. They weren't positioned ideally, which if you think of perhaps putting one ear on a shoulder and holding it there for a few moments, if the baby's stuck in that position for the last month of its gestation during pregnancy, you can imagine that it's going to come out and it's going to have a fairly stiff neck. And the nerves that come off the brain, that come through the neck, go down into the stomach, then can be affected by that and create symptoms that tell you this baby's not happy. They may also not want to latch on one side while they're feeding because their neck is stuck in one position. So all of these things can then be assessed by the chiropractor and the appropriate therapies given so that those colicky babies and babies with other issues can benefit from it.
Wow. Okay. I also understand that chiropractors help with conditions like anxiety, depression, or chronic stress for that matter. How do you address all of those issues? And I'm also wondering, with younger children, how do you pick up that child is suffering from anxiety? It's easy, as you've indicated, with adults. I can tell you what I'm going through, and you can then diagnose my situation. But with younger children, they're not able to articulate exactly what's going through. So, how do you actually come
Children
to the
are a
conclusion?
they're a special group to be working with. And as I said a little earlier, a lot of it is observation and report backs much of behavior. So children will express their distress in the way they're responding to their environments. So questioning them about, how they're coping at school, it depends on the age, of course, of the child, of where you're at. And we are unfortunately picking up anxiety in children going from grade R into class 1, for example. They either become more withdrawn, they're not as engaged, they go into a more shut down situation, or they play out their emotions and they become a lot more expressive, is maybe a positive word that we can use. And those changes in behavior are often the clues that we're looking for to give us an idea that perhaps that child is distressed. It goes back perhaps to the nervous system again. In our autonomic nervous system, so the autonomic nervous system works all the stuff that you're not thinking about. How fast is your heart beating? How well is your stomach digesting its food? These things this nervous system has two sides to it. And we've heard of the fight-flight part of our nervous system. This is our stress response. It's driven by the sympathetic nervous system, and it releases adrenaline into our system so that we can react to the environment around us. It's often a safety mechanism. So when we're feeling fear or feeling threatened, this system is going to come up. We have it at very strange times, like for the 5 minutes before I came and spoke to you, my stomach was going, oh my goodness gracious me. So you get this roiling in your tummy, your heart rate's going up, and that is a sympathetic stress response. Your body is trying to protect you. It's preparing you to fight whatever's coming at you, because this is obviously very anxiety creating, or otherwise to flee. I've got to get out of this situation. I'm not coping. Unfortunately, there's a step down that can happen within the nervous system as well, which is called the freeze response. And this response disengages us. We become separate from everything that is going on around us. And this means that we can't respond at all. So a freeze response is more severe than a reactive response, which is at least the nervous system is mobilizing. And with a little bit of guidance, we can help children to manage that side of it. Versus when the other side of the nervous system, which is now our rest, digest, healing, and repair. So this is the parasympathetic nervous system that's controlling this side of it. And that helps us create balance when we have been exposed to a stressful reaction. So stress is normal. It happens in our lives all the time, and we need these responses as a healthy reaction, but we can't get stuck in them. And even young children are not learning how to manage their stresses so that they can shift from a stress response into a relaxation response. And this parasympathetic rest and digest healing side of our nervous system is activated by many of the things that we do to help bring us to center. So breath work is wonderfully helpful. Unfortunately, small babies, colicky ones in this case, don't have that regulation control themselves. So if you put the baby on you and you do the breathing, we've done a lot of skin to skin processes. This is very beautiful for the connection between mom and baby or dad and baby, and use your system to help the child regulate theirs. This is effective right up through toddlerhood, that you can be the place where the child can help regulate themselves. So we as parents need to learn these skills as well, because it's in demonstrating them that children can learn from us, and they see how we cope with our stress, and they can start engaging those processes in themselves to help stress and anxiety occurring in their world. You asked another question about depression and anxiety and all of those things. Should I go there next?
Unfortunately, we've run out of time. This means that we need to schedule another interview with you sometime soon. But let me wrap up by asking the all-important question. What is current research showing us regarding the effectiveness of brain-based chiropractic care? The other thing I'd like to explore with you, but not today, at a future time, at a future interview, regarding dementia, because I'm sure you find that equally fascinating, and we'll keep it for the next interview. But if you could just tell me about modern, what's research telling us about the future of healing through chiropractics?
There's some wonderful research coming out of the university in New Zealand. Dr. Heidi Harvick is doing a lot of neurological research and the effect of chiropractic care on various conditions. A lot of things to do with, say, neck pain and how it impacts into our balance and coordination. So if you're getting adjusted, you're more accurate at throwing darts, for example, as an exercise that she was using to see how coordination is improved. You can get relief from chiropractic care and improvement in that balance and coordination. So the signaling between the brain and the body then is better. That's one of the best places that there's research coming out, and we're very pleased to see it coming out. Of course, research gets published and it's only 5 or 10 years later that it becomes mainstream knowledge. So we're working very hard at informing people that chiropractic can benefit any condition that your nervous system controls.
Very, very quickly, a short answer, please. Do you prescribe medication at all to your patients, or is this a practice that doesn't? Is chiropractic as a whole a non-medicating therapy?
Yes. So we prescribe or subscribe to the fact that the body has a natural ability to heal itself, and anything from the outside is going to potentially interfere with that. So in our scope of practice, we don't prescribe any allopathic medications. I will make recommendations as far as supplementation goes, perhaps homeopathic remedies to support the healing process. But we really want to stimulate the person's ability to heal themselves, which is very much a lifestyle thing. Are you sleeping enough? Are you exercising? Do you eat a good diet? Are you mentally, emotionally, spiritually aligned. And those things support how well we can heal and repair. And chiropractic is a very healthy, natural adjunct to that.
Dr. Susan Goslett, it's been an absolutely fascinating and interesting discussion. I look forward to talking with you again. And very quickly, you are based in Randburg, Linden, Randburg?
In Ferndale in Randburg, yes. I am also currently in the process of moving, so I'm working at a centre in Pretoria, a birthing centre, because I have a special interest, as you said earlier, in pregnancy and children. So there as well.
Okay, great stuff. Lovely talking to you. Go well, and I look forward to a future discussion.
Thank you for your time, Julie. It's been wonderful chatting.
Absolutely. It is 3 after 12 o'clock. That was Dr. Susan Goslett talking to us about chiropractics, a health, a science. And if you've ever wondered about it, like I have always, she's given us some really straight answers to when to consult with a chiropractor. And I do look forward to talking with her again sometime soon. It is 3 after 12 o'clock, and in a minute or two, we will be joined by Dr. Nazim Abrams and a guest, rather the second guest. It's going to be a three-way conversation. She is, in fact, Raisa Abdullah. Please stay with us.